A very good morning to all of you. I am Dr. Naveen Kumar Devangan, Professor in the Department of Electronics and Telecommunication Engineering, Bhilai Institute of Technology, Durg. It is a great pleasure to be here today with you all and talk about the exciting world of biomedical instrumentation and sensors in the fascinating realm of computed tomography. First of all, we will start with drawbacks of conventional X-ray imaging before we proceed to CT imaging. Then we will see the introduction of computed tomography. Here we will see computed tomography as an imaging technique to provide cross sectional images of the body's internal organs and tissues. Then we will see the principles of computed tomography. There we will see the principle of image reconstruction. Then we will see basic technique and its block diagram. Then I will talk about contrast scale used in creating CT images. We will also talk about applications of CT. Finally, I will compare CT imaging system with other imaging systems like MRI and ultrasound imaging system. Now, we are going to see the drawbacks of conventional X-ray imaging. There are two main limitations of using conventional X-rays to examine internal structures of the body. First, the superimposition of the three-dimensional information onto a single plane makes diagnosis confusing and often very difficult. Second, the photographic film usually used for making radiographs has a limited dynamic range, and therefore, only objects that have large variations in X-ray absorption relative to their surroundings will cause sufficient contrast differences on the film to be distinguished by the eye. Thus, whilst details of bony structures can be clearly seen, it is difficult to discern the shape and composition of soft tissue organs accurately in conventional X-ray imaging. In such situations, growths and abnormalities within tissue only show a very small contrast difference on the film, and consequently it is extremely difficult to detect them even after using various injected contrast medium in conventional X-ray imaging. The problem becomes even more serious while carrying out studies of the brain due to its overall shielding of the soft tissue by the dense bone of the skull in conventional X-ray imaging. To overcome these limitations, computed tomography, that is CAT, was invented and developed by G.N. Hounsfield in the year 1972. Despite the inherently high cost of the equipments, several thousands of these are now installed in hospitals all over the world. It is known as computed axial tomography, in short CAT or CT scan. The word tomography is derived from the Greek word tomos. Tomos means slice or section, and graphene, it means is to write. So, tomogram is a record obtained by tomography, and tomography is a technique for displaying a representation of a cross section through a human body or other solid object using X-rays. In CT imaging system, X-ray slice data is generated using an X-ray source that rotates around the object. X-ray sensors are positioned on the opposite side of the circle from the X-ray source. Many data scans are progressively taken as the object is gradually passed through the gantry. They are combined together by the mathematical procedure known as tomographic reconstruction. CT produces a volume of data which can be manipulated through a process known as windowing in order to demonstrate various structures based on their ability to block the X-ray beam. Although historically the images generated were in the axial or transverse plane in 2 dimension, that is orthogonal to the long axis of the body, modern scanners allow this volume of data to be reformatted in various planes or even as volumetric 3-dimensional representations of structures. Now, next I am going to explain basic principles of CT scan. Computed tomography differs from conventional X-ray techniques in that the pictures displayed are not photographs, but are reconstructed from a large number of absorption profiles taken at regular angular intervals around a slice, with each profile being made up from a parallel set of absorption values through the object. In computed tomography, X-rays from a finely collimated source are made to pass through a slice of the object or patient from a variety of directions. The mathematical basis for producing an image of the cross section, that is slice of the body, is that if one measures the total attenuation along rows and columns of a matrix, one can compute the attenuation of the matrix elements at the intersections of the rows and columns. CT uses the knowledge of the attenuation coefficient sums derived from X-ray intensity measurements made at all the various irradiation directions to calculate the attenuation coefficients of each individual voxel to form the CT image. The number of mathematical operations necessary to yield clinically applicable and accurate images is so large that a computer is essential to do them. So, computer is very essential part of CT imaging system. Computer performs the calculations and obtain an information. From this information, a 2D picture, that is slices, can be obtained. If a slice of heterogeneous tissue is irradiated and we divide the slice into volume elements or voxels, with each voxel having its own attenuation coefficient, it is obvious that the sum of the voxel attenuation coefficients for each X-ray beam direction can be determined from the experimentally measured beam intensities for a given voxel width, and you can see this process in figure 1. However, each individual voxel attenuation coefficient remains unknown. Computed tomography uses the knowledge of the attenuation coefficient sums derived from X-ray intensity measurements made at all the various irradiation directions to calculate the attenuation coefficients of each individual voxel to form the CT image. Now, next I am going to explain basic technique and block diagram of a CT machine. Figure 2 shows the complete block diagram of CT imaging system. You can see in this figure that a CT scan system consists of X-ray tube and detector, couch for patient, high voltage supply, timing kilovolt and milliampere control, tube position control. You can also see dedicated microcomputer, storage devices and output unit along with a camera. We will see the function and working of each block. The timing, anode voltage kV and beam current milliampere are controlled by a computer through a control bus. From the keyboard mounted on the operating console, details such as the patient's code, the name of the hospital, etc., are fed into the system, and settings for X-ray parameters for the scan are made. The X-ray source and detectors are mounted opposite each other in a rigid gantry with the patient lying in between, and by moving one or both of these around and across the relevant sections, which is how the measurements are made. The high voltage DC power supply drives an X-ray tube that can be mechanically rotated along the circumference of a gantry. The patient lies on a motorized couch and is moved into the aperture of the gantry, with the location to be accurately determined by means of a narrow strip of light that falls on the body from the gantry and illuminates the section to be examined. The X-rays pass through the patient and are partially absorbed, and the remaining X-ray photons impinge upon several of as many as 1000 radiation detectors fixed around the circumference of the gantry. The detector response is directly related to the number of photons impinging on it, and so to tissue density, since a greater portion of X-rays passing through dense tissues are absorbed than that are absorbed by the less dense tissues. When they strike the detectors, the X-ray photons are converted into scintillations. The detectors are usually sodium iodide crystals, which are thallium doped to prevent an afterglow. The detectors absorb the X-ray photons and emit the energy as visible light. This is then converted to electrons by a photomultiplier tube and then amplified. Analog outputs from these tubes go through signal conditioning circuitry that amplifies, clips and shapes the signals. Relatively simple analog to digital converter then prepares the signals for the computer. The set of readings thus produced enables the computer to compensate for fluctuations of X-ray intensity. Also, the reference readings taken at the end of each traverse are used to continuously calibrate the detection system, and the necessary correction is carried out. The computer senses the position of the X-ray tube and samples the output of the detector along a diameter line opposite to the X-ray tube. A calculation based on data obtained from a complete scan is made by the computer. The output unit then produces a visual image of a transverse plane cross section of the patient on the CRT. It can also be photographed with a camera to produce a hard copy record. After the initial preprocessing, the final image is put onto the system disk. This allows for direct viewing on the operator's console. The present day CT machines can obtain slices in 1 to 2 seconds in high resolution and in 5 to 10 seconds in precision modes. The picture is constructed in either a 320 into 320 matrix of 0.73 millimeter squares, giving higher spatial resolution, or in a 160 into 160 matrix of 1.5 millimeter squares, which results in higher precision, lower noise image, and better discrimination between tissues of similar density. Each picture element that makes up the image matrix has a CT number, say between minus 1000 and plus 1000, and therefore takes up one computer word. A complete picture occupies approximately 100 K words, and up to 8 such pictures can be stored on the system disk. There is a precise linear relationship between the CT numbers and the actual X-ray absorption values, and the scale is defined by air at minus 1000 and by water at 0. Obviously, the quality of the reconstructed image is a matter of the differentiation between mu, that is X-ray attenuation coefficient, at different points and of the size of each pixel, square dots of light whose intensity varies to reflect the attenuation. Table 1 shows specific gravity and attenuation coefficient for various materials. Here mu is the attenuation coefficient of the materials. Hence, you can conclude the image reconstructed as a result of computerized tomography can be considered as the mapping of densities, as you can see in table 1 with respect to that of water. We are going to see contrast scale generally used to create CT images. The linear attenuation coefficient value of tissue is represented by the scanner computer as integers that usually range in values from minus 1000 to plus 1000. The values are normalized to the value for water as a reference. These integers have been given the name Hounsfield units and are abbreviated as capital H. They are also denoted by CT numbers. The relationship between the linear attenuation coefficient mu and the corresponding Hounsfield unit is H is equal to mu minus mu water divided by mu water into 1000, where mu water is equal to attenuation coefficient of water. The CT number scale can be defined in such a way that 0 is assigned to the water and minus 1000 to the air. The value plus 1000 represents highly dense materials, since neither the human eye nor the television display system is able to differentiate all the 2000 steps in this scale. Only a section of the scale is represented on the video monitor. Therefore, viewing systems have window level and window width controls. These controls determine where and over what range of CT numbers will the video grayscale possibly lie. A decrease in window width enables us to see very small changes in tissue density more clearly. Since the grayscale becomes spread over a smaller range and any given change in the tissue density shows an increased contrast. However, it is necessary to move the window up and down the CT scale by means of the level control, so that the absorption values under examination will be displayed between black and white on the monitor. The equipment is provided with a facility for the selection of the window widths either in the steps of 0, 32, 64, 128, 256, 512 and 1024 or freely. The middle position of the window can be set between minus 1024 and plus 1023 or between minus 512 and plus 1535. In the relevant range of the effective radiation energy between 60 and 80 kilo electron volt, the differences in the attenuation values of plexiglass and water are largely constant. The measured CT values and the known mu values of these substances are implied in a CT number scale, and the ratio of the difference of the CT values to the corresponding difference of the values is given by the slope of the straight line. It is given by 1 by k is equal to CT plex minus CT water divided by mu plex minus mu water, where mu plex minus mu water is equal to 0.024 per centimeter, mu water is equal to 0.197 per centimeter at 66 kilo electron volt, while k is equal to 1.9 into 10 to the power minus 4 per centimeter per CT value. Thus, the mu value for various tissues can be computed by simply multiplying the measured CT value by k. It may be noted that this is in fact correct for all materials equivalent to water or plexiglass, for example, soft tissue. But in a combination of bone and soft tissue, the actual mu values cannot be easily extracted from the CT numbers because the X-ray radiation is polychromatic and subject to so called beam hardening. Most commercial CT machines have a spatial resolution of around 2 millimeter, and almost without exception the manufacturers claim a noise level corresponding to a 0.5% change in the X-ray absorption coefficient. Achieving this level of discrimination in a normal radiograph would require X-ray intensity differences of about 0.0% to be rendered visible on the film. The linear absorption coefficient of soft tissue is about 0.2 per centimeter, and the change of intensity would be 0.2 per centimeter into 0.2 centimeter into 0.5%. So, that is equal to 0.02%. So, with conventional projection radiography, an intensity change of 0.0% is of 2 orders of magnitude, smaller than the maximum detectable change possible with that of modality. Now, we will see the applications of CT scan. Body CT scan can diagnose a variety of conditions such as broken bones like skull, spine, ribs, extremities, blood clots in the brain and chest, abnormalities of the lung such as pneumonia, inflammation in the abdomen such as appendicitis or gallbladder disease, stones in the gallbladder or kidneys, blocked bowel passage or twisted bowel, cancers in various organs and body parts. All this can be detected using CT images. Diagnosis of cerebrovascular accidents and intracranial hemorrhage is the most frequent reason for a head CT or CT brain scanning is done with or without intravenous contrast agents. CT generally does not exclude infarct in the acute stages of a stroke. However, CT is useful to exclude an intracranial hemorrhage as a cause or complication of the stroke. For the detection of acute hemorrhage, especially subarachnoid hemorrhage, CT is the test of choice as it is more sensitive than MRI. For detection of tumors, CT scanning with some contrast is occasionally used, but is less sensitive than MRI. CT is also useful in the setting of trauma for evaluating facial and skull fractures. CT has an important role in evaluation of the functioning of a ventriculoperitoneal shunt by demonstrating the volume of the ventricular system. Although CT cannot assess intracranial pressure, it can demonstrate several important causes of raised intracranial pressure. Despite the limitation that CT may not detect raised intracranial pressure, it may help in the clinical decision to perform lumbar puncture and is often performed in this context. In the head, neck and mouth, CT scanning is used for surgical planning for craniofacial and dentofacial deformities, evaluation of cysts and some tumors of the jaws, paranasal sinuses, nasal cavity, orbits, diagnosis of the causes of chronic sinusitis and for planning of dental implant reconstruction. Now, we are going to see some common use of the CT procedure. CT is one of the best and fastest tools for examining the chest, abdomen and pelvis. CT provides detailed cross-sectional view all types of tissues. CT is used to examine patients with severe injuries from incidents such as a motor vehicle accident. CT scan is performed on patients with acute symptoms such as abdominal pain or difficulty in breathing. Often the best method for detecting many different cancers including lung, liver, kidney and pancreatic cancer, since the image allows a physician to confirm the presence of a tumor and measure its size, precise location and the extent of the tumor's involvement with other nearby tissue. An examination that plays a significant role in the detection, diagnosis and treatment of vascular diseases that can lead to stroke or kidney failure or even death. CT is commonly used to assess for pulmonary embolism, that is a blood clot in the lung vessels, as well as for abdominal aortic aneurysm. Invaluable in diagnosing and treating spinal problems and injuries to the hands, feet and other skeleton structures, because it can clearly show even very small bones as well as surrounding tissues such as muscle and blood vessels. For children, CT imaging is more often used to evaluate lymphoma, neuroblastoma, kidney tumors, congenital and malformations of the heart, kidneys and blood vessels, cystic fibrosis, complications of acute appendicitis, complications of pneumonia, inflammatory bowel disease, severe injuries. Physician often uses the CT examination to quickly identify injuries to the lungs, heart and vessels, liver, spleen, kidneys, bowel or other internal organs in the case of trauma. Guide biopsies and other procedures such abscess, drainage and minimally invasive tumor treatments. Plan for and assess the results of surgery such as organ transplants or gastric bypass. Stage, plan and properly administer radiation treatments for tumors as well as monitor response chemotherapy. Measure bone mineral density for the detection of osteoporosis. Now, going to compare CT scan with MRI scan. Unlike CT scans and X-rays, MRI scans do not utilize potentially dangerous ionizing radiation. An MRI scan employs radio waves and powerful magnetic fields, whereas a CT scan uses X-rays. Although MRI scan gives more detailed images, CT scans are more widely used and less expensive. In an NMR imaging system, cross-sectional images of any orientations are achievable. NMR imaging, in contrast to CT, does not require gantries, moving parts or specialized crystal detectors. Electrically controlled magnetic fields are superimposed as the system scans. As a result, scanning in any predetermined orientation is conceivable in MRI. With the new methods being developed, NMR now allows for simultaneous imaging of complete three-dimensional volumes as opposed to the slice by slice method used by traditional imaging technologies. Now, I am going to compare CT with ultrasound imaging. Ultrasound's main attraction as an imaging modality lies in its non-invasive character and ability to distinguish interfaces between soft tissues. Ultrasound is not only non-invasive, externally applied and non-traumatic, but also apparently safe at the acoustical intensities and duty cycles presently used in diagnostic equipment is safe. CT, though non-invasive, but uses X-rays which are having ionizing properties. Diagnostic ultrasound is applied for obtaining images of almost the entire range of internal organs in the abdomen. These include the kidney, liver, spleen, pancreas, bladder, major blood vessels and of course, the fetus during pregnancy. Ultrasound has also been usefully employed to present pictures of the thyroid glands, the eyes, the breasts and a variety of other superficial structures. In a number of medically meaningful cases, ultrasonic diagnostics has made possible the detection of cysts, tumors or cancer in these organs. Ultrasound imaging is possible in structures where other diagnostic methods by themselves were found to be either inapplicable, insufficient, or unacceptably hazardous. The main limitation of ultrasound, however, is that it is almost completely reflected at boundaries with gas and is a serious restriction in investigation of and through gas containing structures. In this slide, you can see a typical CT scan machine. You can see it as a huge machine. You can see in this figure the patient couch and an annular tube gantry where source and detectors are placed diametrically opposite with each other. Couch or bed can be moved in or out in the annular gantry. Source and detector can be rotated to cover whole slice scan of the tissues of interest. Helical movement of the tube or movement of the patient in and out can create images in various transverse plane, and by combining these 2D images, 3D images can also be reconstructed. I have shown in this slide CT scan of the liver. I have also shown the CT image of the mid abdomen where you can see various parts of the abdomen. You can observe from these CT images that the CT images are more clearer and can offer better images in case of soft tissues as compared to conventional X-ray images. Now, with a brief revision, I would like to complete my today's lecture on computed tomography. I have completed drawbacks of conventional X-ray imaging. I have also compared the CT with MRI and ultrasound imaging. I have covered the basis of image reconstruction in CT. I have also covered the CT scan machine, its block diagram by explaining the function of each block. I have also covered the applications of CT. With this, I complete my today's lecture on CT imaging. If you need any further information or clarification, feel free to contact me through my mail naveen.devangan@bitdurg.ac.in. In my next lecture, I will be available with another interesting topic of biomedical instrumentation and sensor. Till then, goodbye. Thank you all.